I started with Rejuvenix somewhere last year a year and a half ago, in early May. And that's when I had my first injections and treatments and physical therapy. And now it's going into July and August.
Most of these patients come in and they've never seen x-ray images of their knees. They're kind of just going based off what they were told, which is you have bad knees. By taking the images with proof to point out to them, you still have some cartilage left, or you're more of a moderate arthritis patient, compared to going to a primary care office where we call them blind injections. It's just kind of a guessing game. It either works or it doesn't. So that's kind of really the benefit of what we do here and why patients keep coming back. The most satisfying part of my job is when a patient comes in, it's their last injection, and we call it graduation day.
I've been having knee pain for quite a while, and old sports injuries, and when they said I got old, I was going to have more pain on my right knee because they had taken cartilage out. And so I suffered with it for several years and said, well, wait a minute. This on the TV, it says Rejuvenix, and I thought I'll give this a try. So I did, and the first time I went through, and it was very successful, I felt. It eliminated the pain, and that's what was promised, that it would eliminate the pain. The first time lasted me close to a year, and then I started having the pain come back again. And it felt like I needed to come back and see the doctor. So I did, and he recommended that we go through another series, and it's been great. Now this is my last third shot on both knees, and it worked out really well, and the pain has again gone away.
When you've tried, pain medicine or whatever, if you want something that's going to last longer, I'm a living testimony. Rejuvenix worked for me. I think you should go try it. It's pain-free. It's a simple process. They counsel you. They take you step by step through the process. There's no hidden agendas. There's no fluff. It's just straightforward. And Rejuvenix worked for me. And I think that you should really try it, and if you don't try it, then you don't know. And if you don't know, then you just have to continuously go through what I went through for a few years by a hidden element. You feel that there's no cure, so you got to deal with it. But once I found Rejuvenix, I feel 100% better.
The pain levels when I first started were definitely in the 9 to 10 range. Then after the first few shots, or the first series you might say, the pain level went down to pretty much a 1 or a 2, and it stayed that way for several months. And then about 9-10 months in, the pain level started coming back up again, and also some, I call it popping of my left knee. And so then I came back in again, and the pain levels at that time were in the 7 to 8 range. They weren't as high as initially, but now the pain levels after some injections, the pain levels again are back down to 1 or 0. Things that I couldn't do before was walk down a hill. That gave me a lot of pain walking downhill. And again on after my first round, still walking down the hill started to hurt again. After 8 to 9 months. And then when I came back in here again, there was inflammation, and they were able to give me a shot, which helped that, but it still didn't solve the problem until I got the real Rejuvenix in there. Then the problem went away again. I could walk down a hill again.
Marvelous, great people. I love them just like they're my family. Lovely. They are the most beautiful people that I ever want to meet, and I'm not stop coming here. I am letting everybody know about Rejuvenix, and I'm sending a lot of people over here.
It was recommended in the beginning that I have physical therapy along with the injections. So the gal that was in there did a super job with the physical therapy, but along with that, she did training for me to do the physical therapy at home. And I continue to this day to do that physical therapy at home. And so the whole system has worked very well for me. I started with RejuvenX somewhere last year a year and a half ago, in early May. And that's when I had my first injections and treatments and physical therapy. And now it's going into July and August. Well, I had seen the advertisement on television many times for RejuvenX. Kind of ignored it for a while. But again, the pain in my knees got so bad that I couldn't ignore it anymore. So I saw that RejuvenX commercial one more time and said, it's time to come in.
I just want to tell you about RejuvenX. This is my 4th time I've gone through the series of shots, and it definitely makes a difference. I can walk. I'm headed to Colorado for a while, and I want to be able to get out and see nature, and I'm going to do it thanks to my RejuvenX shots.
So I'm a nurse practitioner here. I'm an injector, so all patients that come through Rejuvinix, I see them first. I take x-ray images, I do diagnostic ultrasound imaging, and kind of formulate a treatment plan for these patients. Once we go over images together, I kind of point out irregularities, things that we can improve, overall anatomy of their knee joint, hip joint, whatever joint they're here to be treated. After we go over that, we get them back for appointments, and that's when we start injections, the fun part. They're very quick, simple, easy injections. I get them laying on the table, bend up their knee. I use x-ray imaging to guide my needle into their joint, deliver the medication within seconds. It's very quick, relatively painless. And patients usually leave pretty satisfied. So we have numbing agents. I use tons of local anesthetic, lidocaine, usually just some easy breathing to kind of work them through the needle phobia, because it is a common thing. It's not fun to be poked. I know I don't like it. So we have ways to kind of offset that first initial pinch. Most of these patients come in and they've never seen x-ray images of their knees. They're kind of just going based off what they were told, which is you have bad knees. By taking the images with proof to point out to them, you still have some cartilage left, or you're more of a moderate arthritis patient. That helps us more diagnose the severity of what we're up against. As far as imaging during the injections, it's really useful to me because I'm able to almost guarantee 99% accuracy that I'm in their joint delivering this medication. They can walk out the door knowing that this was successful, compared to going to a primary care office where we call them blind injections. It's just kind of a guessing game. It either works or it doesn't. So that's kind of really the benefit of what we do here and why patients keep coming back. So starting with Toradol, first and foremost, almost every single x-ray I take shows a lot of inflammation in the knee, right? Because if you're wearing down the healthy cartilage of your knee, that's causing friction, it's causing inflammation. The Toradol is a very potent anti-inflammatory that works really well, really fast to first and foremost calm down the knee. We want to calm it down, make it a happy, calm environment. In doing that, it makes the gel more successful inside of the knee, giving you that lubrication, that cushioning back. It has a better success rate to last months and months and months, and become something that can last people, keep them symptom-free for longer. So starting with the Toradol is definitely of benefit to these patients. And some people it's enough to keep their pain away. Some we need to move on to the HA, the hyaluronic acid. So hyaluronic acid, it's a molecule that occurs naturally in all of our joints, right? Our body naturally creates this molecule. What we deliver here is a synthetic form of this hyaluronic acid. So from arthritis, your body breaks down the healthy synovial fluid I'll talk about the knee joint. So the hyaluronic acid I deliver is a synthetic form of what we already have. It's going to cushion, it's going to lubricate the knee joint, take some stress and pressure off the knee with things like walking, standing, even getting in and out of your bed or your car. It really alleviates symptoms in that way. It's something that has to build up over time, but a lot of patients have seen really good success with it. So for patients with pretty severe arthritis, sometimes I call it an oil change for the knee. The hyaluronic acid isn't quite as successful, or we don't get the response that the patient's looking for, quality of life-wise. That's when we move into our radiofrequency ablation procedure. It's done here in our office. It's non-surgical. It involves the nerves that feed the knee pain sensation. So we all have nerves all throughout our body. We have nerves called the genicular nerves that feed pain. Okay, so the radiofrequency ablation, what I do is I insert a probe into the knee, I go down to that nerve, and I turn on a machine that's going to heat up this tip of the probe. It's going to ablate the nerve, and doing that, by dissolving that nerve coat, it interrupts that pain signal. So that is no longer being sent from your brain to your knee. That's something that provides relief for a year or beyond, because nerves regenerate very slowly. So it's kind of a step past the HA, the hyaluronic acid gel. People see really good responses from it. You know, even if they can get 50% of their pain eliminated, I say that's a success for people who are walking around with really severe arthritis, bone on bone, as we like to say. The radiofrequency ablation is a really good next step. So radiofrequency ablation, it interrupts this pain signal that your knee is sending to your brain, saying, ow, my knee hurts. By me inserting this probe, heating it up, it dissolves that nerve coat, so that pain signal is no longer being sent to your brain. The most satisfying part of my job is when a patient comes in, it's their last injection, and we call it graduation day. They say, this really worked. You know, I'm gonna miss you guys. I don't wanna be back in here anytime soon to see you because my knees are gonna be feeling good. But the most satisfying part is definitely when patients come in, say, this really helped me. I don't need to think about surgery. You know, I can take my dog for a walk around the block without pain. That makes it all worth it. I love my team members. I have Emma in the room with me. She's a great support staff to keep my hands working. You know, she helps me operate my machines, my x-ray, my ultrasound. Front office staff is great. They communicate super well with me when patients come in and out. Dr. Fuller's wonderful with giving consults and getting me new patients in the door to provide injections and give some relief to.